Brilliant. My understanding is that next up we have a talk from the Occupational Therapy team, and I'd be absolutely delighted if they come up and talk to you. I only met them very recently, and I said, what could occupational therapy do to me? And I'm about to hear the answer.
And I told you. Well, I sort of told you. And I have 5 minutes, and Hayley meant 5 minutes. Hello everybody, thank you for turning out on this wet Saturday afternoon. My name is Annie Turner, and I'm here wearing 2 hats today. One is that I am an occupational therapist, but I'm also a survivor of 2 tumours. So I've got both hats on today. So what I want to do just very briefly is to tell you how occupational therapy actually helped me, and then pass you over to Hayley, who can talk to you more about what she can offer in terms of occupational therapy helping you. So you may wonder why on earth we're here, and you may have had experience of occupational therapy, which is absolutely nothing to do with anything you thought you were going to be hearing today. So you may have come across occupational therapy helping people who've broken their limbs. You may have come across occupational therapy with people who have schizophrenia. And you are none of the above, so you think, well, what on earth are we doing here? Well, occupational therapists are regulated health professionals. They work with people whose lives have been interrupted primarily through illness, but not necessarily. And what they do is to help them participate in what they want or need to do in their everyday lives. So what they do is to work using activity. Activity is the medium through which occupational therapists work, and they use activities that people have identified as being important to them in order to help them regain and maintain their everyday lives. So they look at the whole person. Now, these days, every health professional says they look at the whole person, but occupational therapists, I think, were saying it long before anybody else. They look at the whole person, and they look at the context of their life, and they help them focus away from their illness onto what they need to be able to do to live a life that reflects who they think they are. So, as I said, I have survived 2 tumours, and I use the theory of occupational therapy to actually get me through the process and get me through the journey. I'm now extremely well, and I don't feel at the moment that I need any help from occupational therapy. But what did I do? Well, because I am an OT, I actually had a conversation with myself. Others would say that I often have conversations with myself, but never mind about that. But occupational therapy with an individual usually starts with a conversation. And I had a conversation about, at the point where I was very poorly, what were the things that were really, really important to me? What were the things that were potent in my life that I wanted to use my limited energy and capacity to be able to do? And knowing that the important thing about this is that what's potent isn't necessarily what we do a lot of. So, okay, in my life, like everybody else, I do a lot of cleaning up, tidying up, going to work. They weren't necessarily what was important. What was important were things like being able to maintain my ability to drive, being able to go over to see my son who lives in Cambridge. Those sorts of things, although I didn't do them a lot, were very, very important. Then I wanted to look at what things I could get rid of, what things actually that I spent a lot of energy on did I not need to do anymore. That was actually fairly straightforward. And what did I need help to do? And what I came up with were a number of things. The most important thing to me was the ability to maintain relationships. Relationships with my family, relationships with my friends, but also, and you may identify with this, to be able to support and protect my family So some of the really, really difficult conversations, I'll come on to this in a minute, actually I didn't have them with my family, I had them with my friends. Because I wanted to keep my family strong, and I wanted to stay strong because my children they were in their teens at the time. So that was important. I wanted to maintain my roles as a wife, as a mum, as a friend, as a worker, interesting the order in which those come out, is it not? And what activities within those roles were actually important. So I couldn't do them all, but what was it in this wife role that I want to be able to maintain? What was it in the mum role that I wanted to be able to maintain? What could other people do that I didn't need to do? And how could we share out, and what could be done? I needed to deal with feelings, I needed to deal with fear. I was very frightened at one point, and I needed to cope with it. And because of the sort of person I am, I did this through writing. I wrote poetry that actually I shared with nobody, funnily enough, except Hayley, but that's another story. But they sit there on my computer, these poems. I just needed to write them. I cooked, I swam, I talked, I danced, and I kept going to work. That was my way of coping with maintaining who I was in this world that had turned itself upside down. The other thing I needed to cope with was energy conservation. The lack of energy is something that I professionally had dealt with many times. To actually have to use that on myself, to think, I can't do that today and that, because I'll fall asleep in the middle. So working with myself and working with other people who are occupational therapists and looking at what I wanted to do, I worked out how to use what energy I had in order to be able to do those things that were really, really important to me. And lastly, initially, when I was particularly poorly, I needed some physical help. I needed help to shower, but I didn't want anybody else to do it. I wanted to do it myself. So I needed some equipment, and I needed help with things like getting in and out of bed, particularly with the second tumour, which took away temporarily all my tummy muscles. And it's amazing how much your tummy muscles are involved, even in things like hoovering, which I gave up without any trouble. So those are some of the sorts of things that occupational therapists can do. What I want to do now is turn over to Hayley, and Hayley will talk to you about the sorts of things that she does.
Hello, and thank you very much for allowing me to come and chat with you today. So my name's Hayley, Singlehurst-Mooney, and yes, I'm an OT. And a couple of years ago, I completed a doctoral study. And that doctoral study explored the transitions people went through when they were living with and beyond a cancer diagnosis. What I was interested in is, what do people do? What is it that they are doing in their normal daily lives that helps them to navigate their way through this experience of cancer? And what are the things that people do that are stopping them? What are the challenges and the barriers that they're coming up against? Since completing that, I've used the approach that I used within the doctoral study and developed it further to embed that within my clinical practice. And what I do is that I help people to find practical solutions that enables them to develop the skills that they need to cope with the self-management of their illness. Not just for them, but also for their families too, if they want to. So some of the things that I do, I help people first and foremost to express. Understanding what has happened, what's important to you, and how this experience is affecting you is really important. Sometimes people will say that the unmentionable actually therefore is unmanageable. And so to help you express it may help get the inside out. Now, not everybody has the words for what's happened, and one of my jobs is to help get that out in whatever way is natural to you. And once we've done that, we can understand then and explore this to see, well, what is important to you? Remember the things that Ali was saying. What's important to you to keep? What's important for you to keep the sense of who you are? And what's important to you to just dump and leave behind? So some of the things I do is help you to develop new routines if you want them, find new ways of living, manage things like stress and some of the emotional responses to this experience. So manage things like fatigue, stress, anxiety, worry, fear. Manage relationships and how they're going to pan out within this new life circumstance. I was working with a lady quite recently who was, dating. She was dating, and she was dating this guy for a long time, but it was after she'd had some of her initial treatment, and they were getting to the stage where they, wanted to move the relationship onto the next level. But how does she tell him? But she's only got one breast. What will happen when he sees it? They hadn't had that conversation. She hadn't got into bed. So we look at practical solutions. Another gentleman was about showing his colostomy bag for the very first time. So those practical solutions seem to be important to people's lives. So I help with body image, not only after surgery, but the consideration before surgery. I also help you manage some of those events that trigger emotional responses, anniversaries, checkups, memories. And I also can support you with going back to work if that's what you want to do or that's what you need to do. We have a lot of information about what we could do and should do when these things happen. What I do and what occupational therapy does is look at how you do that. How do you embed these shoulds and coulds within the current life circumstance and within your current lifestyle? So I work with you as an individual, or I can work with your family or in groups. I offer sustained support, and that was something that came out of the doctoral study, was this sustained support, not just at the event, not just the first 6 months after your initial treatment, but throughout your lifetime for as long as you want it, because that means I can see the breadth of this experience, and you can see the breadth, and you have somebody that knows you. And obviously we do these things through activity. So I've used writing, we visited gyms, swimming pools, weightlifting, pottery, baking, whatever it is. We use various occupations that are meaningful to you. But the overall aim is to support your recovery and to support you in creating a lifestyle that may help you prevent and reduce your risk, but also to promote your well-being. And it's a well-being that really enables you to enjoy your life, to put you at the forefront and not the illness, and help you live the life for the way that you want to do it. I will be available, I can't remember the room, but I will be available to chat to, and I think Annie's going to stick around as well. So if you do need any information, just come and chat to me. Thank you.
Fantastic. Did anybody want to ask anything at the moment? Super.
Yeah, how would one access your services?
There are people like Hayley today, and obviously you can talk to her. There are various ways. The theory is you should be able to access either through your GP, you can self-refer, you can access through social services. Those are probably the main ways.
Yes.
But it's a bit like accessing a medic. You need to make sure that you access the person who has the experience in the field that you're in. So there will be occupational therapists, for instance, who work with people with broken bones, and they possibly won't be as helpful as other people who've made a speciality in this particular area.
You know, just wondering how that message is conveyed to the professionals, GPs, for instance.
We're working on that.
Believe me, we would all like to know that.
Yeah, that is something that certainly the people I've been working with are quite frustrated about.
Yeah, common problem.
Yes, but they don't know that the service is out there, or if they do get referred, it's not quite what they want.
Point.
Yeah.
Okay, so thank you so much for that. There'll be an opportunity for further questions later on this afternoon.